Hello, my name is Allison. I'm a student nurse with Missouri State University, and I'm here to give you a quick exam. Can you tell me your name and date of birth?
Carly Kemp, 8/23/2000.
Okay. So like I said, I'm here to give you a neuro exam, which means I'm going to be assessing your cranial nerves, reflexes, muscles, things like that. So I'm assessing the environment. I see nothing that needs my immediate attention. I'm going to provide privacy and perform hand hygiene. Can you tell me your pronouns?
She, her.
Do you have any cultural considerations you'd like for me to be aware of?
No.
Okay. Can you rate your pain for me on a scale of 0 to 10?
0.
Okay. So the first thing we're going to assess is cranial nerves. So cranial nerve 1, I'm going to have you close your eyes and identify the smell.
Pumpkin.
Awesome. Cranial nerve 1 is intact. Cranial nerve 2, I'm going to have you read this line for me.
Wake up smiling.
And read this line.
Take chances.
Okay. And then the next one, I'm going to have you look straight at me and tell me when you can see my finger.
No. 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 No.
Okay. Cranial nerve 2 is intact. I'm going to assess cranial nerves 3, 4, and 6. So the first one is I need you to look directly at me.
Okay.
Okay. Awesome. And then I need you to stare at this pen and then switch your gaze to the wall behind it. Okay. And then follow the pen. Okay. Cranial nerves 3, 4, and 6 are intact. Cranial nerve 5, will you clench your jaw for me? Okay. And then close your eyes and tell me what part of your face I'm touching.
Forehead. Cheek. Chin.
Okay. Perfect. Cranial nerve 5 is intact. Cranial nerve 7, can you smile for me? Puff out your cheeks. Awesome. Cranial nerve 7 is intact. Cranial nerve 8, I'm going to have you cover your left ear and repeat the phrase that I'm saying.
Okay. Elephant.
Okay. And then can I have you cover your other ear for me?
Penguin.
Perfect. Cranial nerve 8 is intact. Next is cranial nerve 9 and 10. So can I have you open your mouth, stick out your tongue, and say ah. Okay. Cranial nerve 9 and 10 is intact. Cranial nerve 11, will you shrug into my hands? Okay. And then, so cranial nerve 11 is intact. Cranial nerve 12, can you stick out your tongue and move it side to side? Awesome. So all of your cranial nerves are intact. So I'm going to move to your upper extremities now.
Okay.
So the first thing I'm going to have you do is push as hard as you can against my hands. Awesome. And then squeeze my fingers as hard as you can. Okay, great. Next, I'm going to assess your reflexes.
Okay.
Okay. Then I'm going to have you close your eyes and tell me where I'm touching.
Okay. Left upper arm. Right lower arm. Both hands.
Okay, awesome. So then next I'm going to have you touch your thumb to your fingers in a repeated motion as fast as you can. Perfect. And then the next I'm going to have you take your fingers and touch your fingers to your nose like this. And then now close your eyes and do it. Perfect. Okay, and then the last thing I'm going to do is I'm going to have you close your eyes and identify what I draw on your palm.
Okay. 9.
Perfect. Okay, I'm going to move on to your lower extremities.
Okay.
So the first thing I'm going to have you do is press against my hands, and then with your feet, and then with the bottoms. Perfect. Okay, the next I'm going to have you do, I forgot to do range of motion on your upper arms, so if you could shrug your shoulders, bend your elbows, and rotate your wrists. Awesome, and then we'll do range of motion on your lower legs, so bend your knees, and then rotate your ankles. Perfect. Awesome. Okay. I'm going to do the same thing I did on your upper arm, so if you close your eyes and tell me where I'm touching.
Left thigh. Both shins. Right foot.
Awesome. Perfect. And then so now I'm going to assess your reflexes. So the first is your patellar reflex. Okay, both of those are intact. And then I'm going to assess your plantar reflex. Okay. Both of those are intact. Next I'm going to have you stand up, and I'll have you walk to the end of the bed using your regular walk. And then I'll have you turn around, and this time when you walk back, I'll have you walk heel to toe.
Okay.
Perfect. And then for the last thing, I'm going to have you stand with your feet close together and your arms at your side and keep your eyes closed. Perfect. You can sit back down. Okay, so you already told me your name. Can you tell me what year it is?
2021.
Can you tell me where you are?
My house.
And what are you doing right now? Or what is happening right now?
I'm studying.
Okay.
With my friend.
Awesome. Okay, patient's mood and behavior are appropriate for the situation. I assess skin integrity during your exam, and everything seems to be in order. Do you have any other considerations or questions that you would like to discuss with me?
Nope.
Okay, I'm once again assessing the environment, making sure that everything looks safe, and I perform hand hygiene. Thank you so much for coming. It was a pleasure speaking with you, and I look forward to seeing you again in a few months.
Thank you.